Okay, I think we can get started. Good afternoon and welcome to this webinar by the HESTIA network on justice and housing. This webinar is part of the UK IEG webinar series on healthy indoor environments in partnership between the EPSRC micro networks and the Leeds Healthy Buildings Network. And today I'm delighted to say that we have got two presentations. First, we have a presentation from Dr. Sally Witcher OBE, who will be presenting on indoor air inequality and removing barriers to inclusion. And second, we have a presentation from Dr. Anna Pagani on leverage points to housing justice, thinking in systems with English social housing stakeholders. So we're going to have both presentations before doing Q&A. So please use the Q&A function if you have any questions for the speakers. So to start, just to introduce Sally, Dr. Sally Witcher OBE is the founder and director of Inclusive New Normal, a social enterprise aiming to drive forward learning arising through the COVID-19 pandemic. She is a commissioner also on the Global Commission on Healthy Indoor Air, as well as an expert advisor to the Safer Air Project in Australia. She's held many formal roles, including as the chair of the Scottish Commission on Social Security, the Disability Employment Advisory Group for the UK Government, as well as being a CEO of Inclusion Scotland and Child Poverty Action Group, and a senior civil servant in the Office for Disability Issues, DWP, and Care Inspectorate board member. She has a PhD on diversity and social inclusion from the University of Edinburgh, as well as an honorary doctorate from the University of Stirling, and is a visiting lecturer at Queen Margaret University College and a member of numerous research advisory committees, including the LSE's Centre for Analysis of Social Exclusion. She was awarded an OBE in 2006 for services to disabled people, and as a disabled person herself who's at high risk from COVID, or as she says, more accurately, responses to it. So I'll pass over to you, Sally, if you'd like to share your screen.
Thank you. I will do my best. Right, can you see that?
Yes, perfect. Thanks, Sally.
Excellent.
Floor's yours for 20 minutes.
Thank you. Right, so just a quick outline of what I'm going to talk about. I'm going to describe very briefly my convoluted journey as to how I come to be here, presenting on a topic like this to this kind of an audience. Not something I think pre-COVID I would ever have imagined doing. I'm going to say a bit about why airborne infection is key to indoor air quality. One thing that struck me is how often debates and discussions about indoor air quality somehow neglect to mention it. I'm going to talk about health impacts, but also more than health impacts. So inequalities of risk. This was a new driver in a way that I certainly identified when the COVID pandemic arrived. Looking at it through the lens of the models of disability equality, human rights, health and environment, thinking about where it intersects with housing retrofit. Then I'm going to give you some examples of lived experience, and then there'll be some time for questions at the end, as Douglas has said. So, starting point, Douglas has already described some of this, so I won't go through it all again. But my key interests throughout my career have been around poverty, equality, social exclusion, and rights. And I have lived experience since childhood as a disabled person. And I'm very keen on co-production. In a way, what I've done through my career is look at these issues through a range of different roles and lenses. And it's almost like doing cross-disciplinary research. That's another parallel. The more angles you look at a thing, the better you understand it. And I'm really passionate about co-production, particularly with people on the sharp end of policy, those that are most disadvantaged by whatever it is that's being discussed. So the COVID-19 pandemic continued big changes. I was in the shielding group, but I've basically been hardly out of my house for the last 6 years, like an awful lot of other people. What we saw when everybody moved online, though, was really interesting. Suddenly, a whole new third sector came into existence, new communities. of support. And as my horizons physically sort of shrunk to the walls of my house, my networks went global. And this was a phenomenon that's still around. Lots of online groups, lots of online communities, and lots of social media groups. And there's been a lot of learning about airborne transmission, much confusion initially, although it's been clear pretty much throughout for those who know that COVID was always airborne. And having got very fed up with governments declaring recovery all over the place, when we were still right in the middle of everything, and feeling more and more despondent, realizing I may never be able to leave my house safely again, and certainly not for the foreseeable future, I set about devising what a strategy for an inclusive new normal would look like. And I actually tweeted it, which was an experience. If you've ever tried tweeting a strategy, it was use the hashtag inclusive new normal. And it got some traction and it stuck. And so that's how that came about. So I imagine people here will know a lot of this stuff, but I'm just going to quickly talk through it. So how airborne infection spreads. Tiny aerosols is the big issue that kind of accumulate in the air like smoke. Government briefly had a publicity campaign. I don't know if you remember this picture in the middle, where it actually sort of fessed up that it was in fact airborne, whilst also telling people to wash their hands and saying happy birthday and such like, which is all pretty confusing. Basically, they have been applying a droplets and contact type infection prevention and control dogma, and in fact they still do, where for something that is airborne, and it frankly doesn't work. But then it's about the fact that it isn't just COVID. There's a whole load of infections that spread primarily through this route. And it's just bizarre, actually, how we can find ourselves in a situation 6 years after after an airborne pandemic arrived, where every year the NHS is overwhelmed by airborne infections, and every year they do precisely nothing until mid-crisis. Then they start closing wards and putting on the wrong kind of mask that isn't going to help them because it's a baggy blue and it kind of gets in around the edges. Right. So there's data, a lot of data's been closed down. So if you want to know how many people have got long COVID, good luck with that, because you'll probably get quoted a figure of 2 million from 2024. But if you look at patterns of long-term conditions and different kinds of illness, there's a very consistent trajectory. And what is also clear is that it isn't just that. It's things like labour market inactivity, it's school absences, it's disability benefit expenditure. And if you just have a look at these trajectories, we're looking at what happens sort of like 2020, things sort of flatten out or sometimes tend to drop, and then they shoot up. And here's another load of similar kinds of charts. There's one on secondary infections. What seems to be coming clear was that people are more vulnerable to secondary infections with COVID, actually quite quickly. And here's a whole load of other ones. So again, the trajectory of all of these things are basically bumbling along till 2020, pretty much, sometimes slightly going up, then flattening or dropping, and then soaring upwards. So something's going on here, even though people are not aware of it. And certainly when they're looking at why benefit expenditure is rising, they're not thinking massive increase in sickness and disability, as in genuine sickness and disability. So it's always a good idea to follow the science, I find. And what you find is that, that there's nearly 500,000 publications on SARS-CoV-2. I actually checked the website today. It currently stands at 487,686. So I'm not quite sure what methodological objections people who think COVID is over and not a thing, or possibly never was, have to all those 500,000 studies. The health impacts, what these show is it's more than respiratory, it's cardiovascular, it's neurological, it's the immune system going haywire, and it's multi-system. There seem to be links to cancer and to diabetes, to fertility, visual impairment, kidney damage, liver damage. It's throughout the whole body. And what we found, what has also become very clear, particularly since 22, is that reinfection increases the probability of long-term consequences. So much of all the data you'll ever see on COVID is about hospital admissions, ICU mortality. The really big issue these days is this isn't the acute infection issue. It is the fact that people have had multiple reinfections. Their immune systems have taken a massive hammering, and so they're susceptible to all kinds of other stuff and find it hard to fight them off. And vaccine is not enough. It's never going to be enough when you're dealing with a virus that rapidly mutates to become immune evasive. So you think somebody might have spotted that, but of course they made assumptions that were not accurate in the early days. So how do we integrate this into the how do we integrate airborne infection into the indoor air landscape? As I've said, I've been really struck. I'm used to working in policy. It's full of silos. I have to say that where it concerns indoor air quality, is extraordinarily siloed in a way that I find really strange. So people think about outdoor air first off when they think about air quality and health issues. Then if they think about indoor air quality, it's probably PM 2.5, might be VOx, might be radon, might be things like that. But it isn't airborne infections. People working on airborne on indoor air quality don't seem to always factor it in. I find that really, I'm sure there are reasons, but I don't know what they are. What we find with post-viral conditions is that what we've learned is that these are physical illnesses, and that they increase clinical vulnerability. So who's actually clinically high risk is changing. More people are becoming clinically high risk. One of the things that people with long COVID and things like ME very often have is something called mast cell activation syndrome. Or sometimes there's always multiple chemical sensitivity, which is a similar kind of idea. So the fragrance others bring in with them is as much a risk as infection. People who are hypersensitive to effectively volatile organic compounds and particles and other things. So COVID, if you look at the kind of impacts of health I mentioned, anyone who's been looking at impacts of other kinds of indoor air hazard are going to be struck by how remarkably similar they are. And that is another reason why you've got to be thinking about this, because if you're investigating health impacts of indoor air quality and you're not including in the mix something that is a major impact, you'll find these are going to be skewed. But what it also means that there are co-benefits, if you like, of indoor air cleaning. So if you sort out the PM 2.5, you're going to sort out the respiratory particles too. If you get rid of VOx, that's going to help people too. But there are also many lessons for delivery and how people interact in providing services, and very much when it comes to co-production methods. So just a quick look at combined health impacts, which are often cross-cutting and reinforcing, and they're cumulative, and wider environmental impacts on indoor air quality too. So one of the things that's very common in social exclusion literature is how one thing leads to another, it all compounds, you spiral downwards. These systems are all interconnected and they knock on, they're like dominoes. And these, so it's cardiovascular, neurological, respiratory, allergies is a big thing, infectious disease transmission, increasing cancer risk, various different indoor air components do that, impaired cognitive function with high CO2, and neurological damage from COVID. And sick building syndrome is obviously to do with just sort of headaches, throat irritation. But for some people, that can be pretty serious. So why else does indoor air quality matter? Well, it's an inequality issue. Not everyone is at equal risk. Health and safety in the workplace is important. It's a human rights issue. It's around a safe environment, health, children's rights, disability rights, create social barriers, which I'll come on to say a bit more about. COVID responses ignoring IAQ. What we talk about, pandemic disability, which includes people who are either at clinical risk, who've paid the price of poor infection prevention and control. And one or two other things there. So obviously it's important here that there are wider societal impacts here. So it's workforce and settings related too. Certain settings are particularly problematic for reasons we'll come on to talk about. Very quickly, medical models of disability equality and social models. This is well embedded in the disability world. Disability activists reject the medical model very often, which is about inequality around disability being to do with your medical condition, and you need to treat it or cure it or build clinical resilience. Social model talks about removing social barriers, attitudes, environment, transport, organisation, communication, extra. These are all external. These are the things that cause the impact. And I just did a quick slide looking at what that might mean for indoor air. So there are attitudinal barriers, the gaslighting of risk in conditions like long COVID and anti-mask hostility, or just not thinking of indoor air, of airborne infection when you're working on IAQ. Environmental barriers, poor indoor air quality is an environmental barrier. So for somebody like me, I used not to be able to get into buildings because there wasn't a ramp. Now, when COVID arrived, I couldn't go into buildings because if I got into them, there was a chance they might kill me. These have very severe health impacts. Organisational barriers, crowded spaces and crowded housing is included in that. Choice of products, of air cleaning and monitoring equipment, communication barriers. There's a big challenge in this world, as I don't need to tell you, making the invisible visible. Huge importance of online communication. If you're wanting to communicate with people for whom indoor air quality isn't safe. Challenges of real-time communication for people with energy impairment. That's another separate issue, which I won't say much about. And then there are financial barriers. So extra costs for masks, air cleaning equipment, and also increasingly private sector health. So quickly on human rights, Global Pledge for Healthy Indoor Air. I had 7 commitments. The first one was about human rights. It says, recognise the importance of healthy indoor air to support existing human rights, including the right to health. Now, I had a look through the European Convention of Rights, and I went through saying, no, I can't, that one I can't do, no, that one. In reality, I can't. A lot of these things were impossible. I couldn't. There were so many things that were indirectly I was prevented from doing because of having to stay in my house. This one's interesting. It's some work by Lab of Lived Experience, looking at basically it was an open letter to the United Nations, looking to calling on them to extend the clean and healthy and sustainable environment rights, wanting to include what they call human biosystems protection. So the idea here, we're kind of getting into the terrain of things like donut economics, I suppose. It's a healthy environment can only be meaningful if it is also about the internal environment. Human and planetary boundaries are interconnected and both must be protected together. And then there's a quote here, which is quite long, but I won't read it all. But I hope slides will be circulated and people might want to have a look at it later. But it's really making the point that there are limits to what the human biosystem can deal with. That's what we're seeing with conditions like ME and long COVID. Multiple systems kind of getting out of sync. And because of being, for a number of different reasons, which some of the time we understand, some of the time we have theories about. So where does this intersect with housing retrofit? Well, I understand housing retrofit to be about things like energy efficiency, decarbonisation, indoor environmental quality, climate resilience. but I would like to think it's also about human resilience, thinking back to the last slides, and it's about accessibility and safety. So it's about how do you square the need to kind of make things sealed to preserve energy efficiency versus what that can mean for air quality and build-up of indoor air generated pollutants and hazards. There were very often, it doesn't seem to be for me, enough emphasis on prevention, a lot of emphasis on mitigation, air cleaning technology. But we need to be trying to stop it happening in the first place. And there are various strategies around that. I think there's one of the weird things I've seen is that the attempts to individualize responsibility for what in effect is something that transmits through shared air. And it means that, and it's part of the wider societal trend around everything being about the individual. That it's not about structural barriers, it's about the individual. And it's not about communities, it's about individuals. You see this playing out with something like shared air, which how can you individualize the air that we're all breathing in? It's just ridiculous. But I also wanted to just flag that there are numbers of different standards and building regs, and I've just seen so many recently. But where does inequality factor into these? Because it may be okay for the majority, but what about people, other people? How are they accommodated in standards? So why it matters at home? The focus for many clinically high-risk people is often on indoor air quality in public places, but home is where many of us have spent the last 6 years, and it's not necessarily possible to keep it safe. Other household members import infection, particularly kids from schools. Some visitors can't be avoided, or as I say, controlled. You can't force them to wear a mask. You can't force them to not to show up without an infection, although you can do your best to bar the door and stop them coming in. But tradespeople, health and social care workers actually are worse offenders on the whole than tradespeople. And landlords, I'll come and say a bit about that. Family members, there can be some tensions sometimes. And then, of course, home is where intergenerational gatherings often happen. So Christmas, I've described as a super spreader event. So navigating the new normal, what do people do? Well, this is what I did was a quick trawl on various social media groups and platforms, and just asked people what was the impact on them? What did they do? And this is pretty much what they told me, and it was very consistent. Visitors are asked to wear respiratory masks, as in FFP2, 3, and 95, which the person will provide. They may be asked to test in advance, depending on what it is and who it is. Anyone symptomatic or with a positive test is refused entry or is asked to reschedule. Ventilation, they open the windows, extractor fans are on. HEPA filtration units are in all or most rooms. That includes activated carbon filters, and some people make their own Corsi Rosenthal boxes. CO2 monitoring is pretty widespread. People understand that tells you about potential risk of a build-up of infection. And people always meet outdoors if possible. So just a quick, I don't know how am I doing for time, Douglas?
You could wrap up in the next couple of minutes, Sally. That would be great.
Okay,
We're
I'll do my
21
best.
minutes.
Okay, so lived experience of family members. Well, the mask doesn't stay on long, and I just pray we'll be okay. The only time we caught COVID was in our own home. Tests hadn't picked up what relative who was staying was infected. We relied on open windows and HEPA filters and us wearing masks, but it wasn't enough, and it was a difficult situation. This one, conversely, says that they have a household of 4 to 5 people, and when somebody has become unwell, they've managed it in such a way that nobody else has got infected. And then there's a list of the things they do, pretty similar to the list I've just outlined. But recognizing that you need money and space to do some of these things, and a lot of people haven't got those. Tradespeople, mostly they're willing to wear a mask. But the kind of things, preparations people have to make, they basically seem to end up sometimes excluding themselves from their own houses whilst the work is going on. So the work meant we had to stay in our caravan locally, and during and after the work. And then in a very elaborate arrangement with somebody running cables out to a teepee and having a picnic food in a bag in the tent, only using the downstairs loo and only going in for that. Housing associations, with some mixed feedback. Two of the housing officers from the housing association refused to put on a mask. One housing association said they were going to ignore a GP's letter explaining that the person was clinically vulnerable, although when threatened with court action, they thought again. However, somebody was very positive about their potential remit, and what they could do with leadership. So because of a social remit, they thought it was a good place to start with an IAQ agenda. But they tried raising the issue, but staff changes continually meant it needed to come from high up. So there's a message there about leadership. Some quick, I'm sorry, I'll shut up soon. Some indoor air failures. So heat exchange systems bringing outside air in have been completely unsafe for people with, I think it might have been multiple chemical sensitivity, but the MCAS is very similar. Overly scented laundry outside and vented tumble dryers are super problematic. And then from the wheelchairs, who on earth thought having windows that have handles 2.5 meters above the ground was a good idea? So there's some messages there about, even with the best intentions, it doesn't always work if you don't talk to people with a lived experience. Then there's some positives. How very pleased somebody was to have a mechanical ventilation heat recovery installed and notice the difference in the CO2 readings. Having an OS switch was really important, as it's not a standard feature. If your home is bigger than a studio flat, then you can socially distance. But somebody ended up with saying, I'd really love to have a built-in ventilation system that alleviates some of the worry. So there are really positive things that can be done around this to address inequality when it comes to people at high clinical risk. So just a few takeaways. Airborne infection transmission is integral to indoor air quality. You have to include it. It's hugely important when it comes to public health and these other matters I mentioned. To address indoor air quality, you have to understand the different drivers. It may be that a whole bunch of people have particular issues, but the reasons for it might be quite different. So it might be exposure risk is the problem when it comes to people who had no particular underlying clinical issue but ended up with long COVID, for example. And it's working age people who have long COVID and post-viral infections. And that's an exposure risk very often. And it's women as well. 80% is huge, hugely high. It's not just about boosting clinical resilience, it's about exposure and structural factors. Excuse me. And poor indoor air quality is a major social and environmental barrier. Protection of eco and biosystems go together. Climate breakdown and human impact go together. They're interconnected. They may even be thought of as the same system, different aspects or of interlocking systems. Lived experience of the most excluded has much to contribute. It isn't just policy that matters or strategy, but what really also matters is how it's implemented on the ground. And co-production. If you're going to talk to people, the most excluded, you have to think about the importance of online. So many events, really interesting events, which people can't get to. You're not hearing the people for whom what is happening is most problematic. And you're not getting their insights into what's going to work. And things you might think are going to work are not going to work. And you won't know unless you ask them. And it's also about ensuring when you have events about indoor air safety, you actually implement indoor air safety and inclusion protocols. So that is it for me. Sorry, I've gone on a bit, but I just really want to thank everybody in the groups that shared their experiences, and clinically vulnerable families and others. So that is it. Thank you.
Thank you very much for that, Sally. That was wonderful. So we'll do questions at the end. So Anna, if you're able to share your screen, and then I can give you an introduction. So Anna's a senior lecturer in engineering at King's College London and an honorary associate professor at University College London. Her research, teaching and engagement lies at the intersection of systems thinking, housing justice and degrowth. And in her work, she engages stakeholders in co-designing systemic interventions aimed at achieving a decommodified housing system underpinned by values of ecological sustainability, local and global equity, conviviality and participation. At King's, Anna's the engineering representative on the Net Zero Centre Steering Committee, where she coordinates the first degrowth seminar series, as well as being an active member of the post-growth planning cluster of the UCL Bartlett School of Planning and of the Post-Growth Cities Coalition. She's also part of several networks, including the multidisciplinary built environment think tank, The Edge, and is listed on the register of specialists for the Ministry of Housing, Communities and Local Government. And I will pass over to you now, Anna.
Thank you. Thanks a lot, Doug. Are the slides visible? All fine?
Yes, all good.
Fantastic. So hi, everyone. And I'm very happy to build on what was said just before me in terms of trying to understand the fact that we have to navigate such an amount of different and complex interrelationships when we talk about justice and when also we talk about health. So today I want to just give you a glimpse into what it means to use a systems thinking approach to understand housing justice in the UK and in particular in England by showing you a project that I did with English social housing stakeholders. So I'm going to start with a couple of numbers that every time I bring them up, they become more and more real. We do all know that there is a housing crisis, a terrible housing crisis in the UK and in England. But when we look at the statistics, it's really terrible, terrifying. We have 8.5 million people in England with unmet housing needs. It could be the whole city of London. 15% of English households live in non-decent homes, and I do teach housing health when I go to UCL, and the definition of non-decent home is really scary. We have 104 children who died in temporary accommodation, and I have 42 master students in my module on applied systems thinking, so we need to think about more than twice the size of the rooms of my students who died in temporary accommodation. And in parallel, we have a very sharp increase in rough sleeping, 171%. So these numbers, when we look at systems thinking, through systems thinking lenses, they're the tip of an iceberg. They're the events. There's what we see and what we can measure. Death, non-decent home, overcrowding, rough sleeping. But systems thinking pushes us to think what lies underwater. And normally there's patterns and trends that have produced those events. A clear pattern that we can see is the sharp reduction in the number and share of social housing in England since, 1979, where social housing used to be a third of the housing stock, going down to half of it, 16% in 2022. So that is a pattern that we are seeing over time, alongside the sector residualization, so access only to the people who are the most in need, racial discrimination, gentrification, disinvestment in housing. But those patterns are produced by underlying structures. For instance, the cross-subsidy model, for which, in order to fund social housing, the sector needs to invest in market housing, and through that mechanisms, being able to build, maintain, repair, provide more generally social homes, or the right to buy mechanism for which people are able to take away from the social housing sector and privatize social housing. Those structures lead to those patterns that eventually produce the events we see. But there is one additional step, which is our mental models. They are at the bottom of the iceberg. And our mental models produce those structures. For instance, our understanding of what are sustainable communities, are they mixed tenure communities or are they monotenure communities? Or what is the role of government or market or communities in providing housing for all? In order to understand how important those mental models are, if we were now all together in a room, I would ask you to play a little game. I would ask you to hold each other's hand and try to squeeze the thumb of the other person as many times as you can, with the goal to make the largest amount of points. And I will give you only 30 seconds to do that. And normally, if you take a moment to think about it, how many points you would make in 30 seconds by squeezing the thumb of the other person. Well, normally my students say maybe make 2, 3, maximum 4, but I've got a couple who managed to do even 30 or even 40 points. And for some of you, it might sound very surprising. Well, how's that possible that we managed to do 40 points? Well, that's because the goal of this exercise is to make the largest amount of points, but I never tell people that they need to compete. They can collaborate and squeeze each other's thumbs as many times as possible to make the largest amount of points in a collaborative way. So that's how strong our mental models are in the way in which they drive us in making decisions. And it can be for a small game in squeezing each other's thumb, but imagine the impact that this has on the whole housing sector when these mental models are what drive it. And so I used an approach that is called community-based system dynamics or participatory systems mapping or participatory system dynamics. You will find many terms for that in order to engage different stakeholders in trying to understand those mental models and what these lead to. So this meant gathering knowledge on how the system works, so systems knowledge, and where we want to go towards and understand what we means, who wants to move towards which target and why, and transformation knowledge. So how do we move from the current system to the desired one? And I'm going to give you a glimpse into what we found, actually. So we started by mapping the content of the Better Social Housing Review. This was showing the key issues in the social housing sector as a starting point. But that review was not enough. We also wanted to include gentrification processes, which are critical for housing justice. And so we included a second read and we started mapping. By mapping, I simply mean that we extracted text from those two reports and we mapped it into variables. An example is, for instance, that this report was talking about the fact that the size of the new dwelling is smaller and smaller, and this can lead to overcrowding, which can, in turn, have negative health impacts for tenants. And so here we were mapping how the size of new dwelling can lead to overcrowding and can impact tenants' health. By doing this exercise of causes and consequences, we developed a range of causal loop diagram. These are systems maps that show reinforcing and balancing dynamics that are at play in producing those tip of the iceberg events that we were seeing on a number of issues, all of which in different ways impact tenants' health and well-being and the sustainability of the sector. But this was not enough. We also brought in large housing associations to discuss with us, to look at the links and think, what did we miss? Is this correct? To revise, confirm and disconfirm and bring their own experience in understanding and revising those maps. And we obtained eventually 4 key diagrams. One on maintenance and repair, showing how the continuous push for building new is diverging funds and resources from maintenance and repair as the center of the system. And I will tell you more about it later. A map on demolition and the reinforcing dynamics that lead to demolish more and more housing, displacing tenants and impact on health, stigma, and other consequences in terms of, again, reinforcing the demolition of social housing stock. The physical and social infrastructure that is available to residents and its erosion over time. And tenant representation and how also this one is eroding over time despite numerous efforts to try to enhance it. And with those maps, we raised a couple of questions. How can we address these problems? What are alternative ways in which we can react to budgetary cuts? How can we unlock the agency of local residents, and so on and so forth? So I told you we now have this systems knowledge. But how do we go about it? And I want to invite you to think about a football team. So as a system, a football team can be also, and anything that we look at in the world can be looked at through systems lenses. So if we look at a football team, we have different elements. These are the players. They're the elements of the system, and they have rules. The rules of the game, it's what regulates their interrelationships. So if I were to change an element of the system with one football player, with another football player, you might argue we might have a slightly stronger football team, but it wouldn't be necessarily so transformational. If we were to change the rules of the game from football to basketball, for instance, well, we would definitely have a different kind of game, wouldn't we? But a system also has a goal, a purpose, or a function. And in a football team, we can think, for instance, to win, ideally, right? And if we were to change the function from winning to losing, well, we would have an entirely different system with players that try absolutely not to score and walk very, very slowly across the field. So the function of the system is the highest leverage point. But this is to explain that when we think about interventions in the system, they do not all have the same power. We might discuss now about how to address housing justice concerns or how to improve housing health, but what we're going to talk about will not have the same leverage in the system. So we gave this example to the housing associations who took part in the workshop. Let's look at some shallower, but still very important intervention. For instance, if we change the players of the football team, we might have more funding for retrofit or a land value tax, etc. If we change the feedback in the team, well, for instance, we can have more maintenance to tackle the constant dependence on construction that we have in the social housing sector. If we go a bit deeper, we're going to change the design. We're going to move from football to basketball, for instance. So we're going to include, for instance, health cost and viability assessments, quite different rules for the system. But we might change from winning to losing or an entire different goal of the system. For instance, is the system geared to provide affordable housing or for developers' viability? Or we can go even deeper in accepting that there's no paradigm or that we need to transcend paradigm. For instance, accepting that alternatives to growth models exist. So we engaged housing associations in this activity using the maps that we had produced and asking them, okay, how do we disrupt these chains that we're observing? And of course, here you will see a lot of post-its and numbers, while on the left, we have the map that we had produced, and they were putting stickers and numbers and thinking where we can act. But it's not enough to think about where we can act, is it? We also need to understand how feasible it is and how impactful. So for each of these interventions, we ask them, well, to place them in a matrix, how impactful and how feasible. And if it's very feasible and very impactful, why is it not happening already? So we had those kind of conversations to really think about ways in which we could transform the social housing sector. I'm just going to, this image can feel overwhelming. It's just to show basically how the different interventions were impacting on different parts of the system. But let's try to zoom a little bit in, for instance. Some interventions in order to foster more maintenance and repair. And I mentioned before, maintenance and repair can have impacts across the system because of the strong dissatisfaction, turnover rate, loss of insights into the housing stock, and so more demolition, and so more new build, etc., etc. Well, we could think about having long-term funding for planned maintenance. This could be an important intervention, a shallower intervention. We can go deeper, thinking about providing insurance for tenants to cover repair. So empowering tenants. Or we can go even deeper about thinking about repair charities and non-profit solutions. So moving really beyond the goal to make profit out of the maintenance and repair system. So what we found in this exercise is that often measures that have to do with reducing the footprint of housing. So shrinking, slowing and extending resource cycles. Alongside those that have to do with equalizing inequalities, like tenure-blind architecture, in which we basically hide the difference between social housing estates and market estates, we're touching the tip of the iceberg. They are incredibly important, but they are shallow intervention. In order to really transform the system, the most effective interventions were those that have to do with democratic, purpose-driven and transparent governance, and those that had to do with overcoming economic growth dynamics. Those acting at that level in the system were eventually having impact on equalizing inequalities and resource use. But I want to have an additional parenthesis of what it actually means to overcome growth dynamics. Is that a provocation, or is it actually an implementable strategy? What we see currently in the housing system is that the problem of the housing crisis sees as a quick fix the idea of building 1.5 million homes. But this does have, by looking at our systems maps, a number of unintended consequences that reinforce the housing crisis itself. So we asked housing associations to take those maps that we had developed together and to try to think, what if we were to stop building entirely across the sector? What if there was a pause? What if there was a moratorium on new house building across the sector? And the answers first came from this linear thinking of, oh no, what would happen this and this way? But then by using the systems map, we had incredibly engaging conversations. What about sufficiency? We have 1.5 million unoccupied dwellings in England, which is exactly the same number as the targets for building new homes. But also, more than 17% of households has 2+ spare bedrooms, meaning that basically a lot of the rooms that we have are not used. And only 50% of those are used to really meet housing needs. So what we have here is the environment paying the price for social inequalities. What about solutions in planning and design that do exist to work better with the existing housing stock? I will not read all of these to you, but by the number you already see that they exist, that there are community right to buy, that there are empty homes programs, that there is multi-generational and intergenerational housing solutions. Also, what about overcoming the idea that building new means building better? Because it has been largely demonstrated that retrofit can be socially, environmentally, and economically better than redevelopment. And fantastic architects, I'm an architect myself, Lakato and Vassal have won the Pritzker Prize, so the Nobel Prize of Architecture, showing how this can really happen, improving the life of residents while they stay in their homes. What about alternative business models of housing provision? There is incredible experiments by Community Land Trust where they managed to actually retrofit existing homes and taking the land out of the speculative market. But in order to do that, we will need to think in systems beyond growth, because of course, doing things like bedroom tax on social housing residents, or those who under-occupy the least, wouldn't be a systemic strategy, or converting offices into homes that don't even have a window would also be an incredibly poor strategy. So to conclude, I just want to have a note about the fact that this sounds fantastic when we work together as a group with housing associations. But there is not only agreement in the sector, of course. We need to think about the fact that each of us in our profession, in our research and in our life sees the problem or the big elephant as a spear, a fan, a wall, a rope, a snake or a tree. And I've done interviews across the housing sector, bringing together the voice of those who were saying that regeneration would improve the quality of homes and its maintenance and repair, those who say that we would have more green space and better spaces for the community and better quality homes, and those who started seeing that this is actually a process, that residents are not happy now but will be happy at the end of it. But I've also talked to those who don't see the final outcome, believe the process in their day-to-day life. seeing dust and dirt, loss of trees, loss of green spaces and greenhouse gas emissions. Seeing how the process changes over decades with planning law, legal system accepting plans to change. And even developers saying that it's incredibly difficult for those changes and in general for long-term benefits on health and environment to be taken into account along the process. So that when we look at housing regeneration as the final goal, what we can see in this image, we need to also take into account that a lot of it is a process. And the goal and the process can be assessed in terms of health in incredibly different ways. So I see the clock of my 20 minutes is up. And so in the last minute, I will summarize you that basically what this process meant for people. So people were able to come to the final event, bringing in their own mental models, but also without the possibility to disclose their affiliation. So it was very difficult to do small talk, as I always say, but at least residents were able to sit down next to housing associations, next to developer, and talk about their own mental models as shown in those maps, and empathize with others' mental models. This means that people at the end in anonymous questionnaire said that they saw that there are practical changes that they can make, that it challenged them to change or disrupt the way in which they do things, and it gave them ambition in thinking. It made them less scared of radical change and focused as much on what is best to do and not what feels the most possible, and that post-growth change is possible. With one participant saying that before they thought that growth and quick growth and higher growth would be always good. So what did we learn? We learned that systems thinking can help challenge the paradigm that participants have for achieving housing justice. That systems map can support discussions on counterintuitive or sometimes radical alternatives to growth-oriented system structures. That participatory approaches can help us talk about, how do we talk about degrowth, which I didn't even talk about in this presentation, but I actually did talk about degrowth. So sometimes using this approach help us talk about things that are difficult to address. And it's very important for those in the public who are academic to have agility, so to create spaces where practitioners can engage with us and open doors to more radical thinking that might not have been really planned at the start. And that systems map can also be used as an alternative and compatible form of evidence to support transformative action. On a final note, we wrote all together with activists, practitioners, and academics a manifesto of housing for a post-growth world. And I'm leaving the link, it's here in the slide. You're free to read it. It's centered on care and all the points that you read here. And feel free also to sign it if you agree. Thank you so much.
Thank you so much, Anna. Well, there were two incredible presentations. We've now got time for a couple of questions. So please do either use the Q&A function or the chat. I think I'll take the chair's prerogative and ask the first one. I think the iceberg model, Anna, is really helpful for sort of seeing what are the, as you say, the underlying structures that lead us to act in certain ways, or the system to act in certain ways. Sort of thinking with Sally's presentation as well, I'm wondering how sort of questions of empathy and care were already fitting into there. And probably this is a question for you as well after Sally, just thinking about what are some of the sort of potential barriers for that sort of ethos of empathy and care in terms of housing design and retrofit. So if you'd like to tackle that first, Anna.
Okay, so barriers in terms of care. Well, we do have a system that is currently, okay, let me start in the way. There is a last publication that is not yet out, but is going to be out soon, on who holds power in the social housing sector, or on perceptions of power. And what is incredible is that basically we looked at the way in which people perceived the system to work and what were the causes and consequences. And what we observe is that most of the people across the social housing sector feel disempowered. They feel like the power lies with someone else. So for residents, it's housing associations. For housing associations, it's developers. For developers, it's shareholders, and so on and so forth. And it is true that we live in a growth-oriented system. And that system drives our decision-making towards growth for the sake of growth. Even the codes of conduct, as shown by the dissertation of one of my undergrad students, of engineers, can't separate sustainability from economic growth. It is true. At the same time, by not perceiving the power we have, we are disempowering ourselves. So architects do have the possibility to shape and to design architecture of care. Housing associations do have the opportunity to exercise their duty of care. And residents do have the opportunity to care for each other. But there are systems that disempower us in caring. And so that will be the first, perhaps, comment.
Thanks, Anna. And I'm wondering how questions of empathy come up for you, Sally, because it's sort of clear that people need to care to do something here, and it seems much easier for people to not think about the difficult questions of inclusion and accessibility.
Well, I think some of the time there's so many different possibilities in here. There's so much needs to be researched, actually. And that's one of those things. What is it that stops people doing these things and empathizing? Some of it's to do with lack of awareness, for sure. There's a lack of data. There's basically been, everybody was told that airborne infection wasn't a thing, that COVID wasn't a thing, or if it was only for the elderly and those with underlying health conditions. The whole language has been very much about dismissing. We talked about restrictions, not protections, and it kind of went from everybody being in the same boat, or so rather same storm, but possibly different boats, to suddenly people being told actually, and at that point everybody was helping. All communities rallied around. There were WhatsApp groups springing up, in the early days of lockdown and so on. Communities really kind of, sprung into action. But as soon as people went back, it became almost that people who were left behind, we were sort of like, we lost our rights to equal citizenship. It became an act of benevolence, of, people remembering. And so part of the problem is to do with rights, the fact that laws are not framed, even the Equality Act is not framed in a way that gives us any some people rights, because it's not about risk of disability, it's about actual experience. It's also about how very siloed a lot of this is. People are looking at this topic through so many different lenses. You've got engineers, you've got chemists, you've got physicists, you've got building standards people, it's just about doctors and medics. And there's no minister for indoor air quality. It's just not joined up. There's no coherent strategy. I was very struck by your picture there, Anna, of the elephant. I mean, this is one hell of an elephant we've got here, and so many people with very different bits of it, and it doesn't come together. So unless people can really, and I think also there's a bit of a sense everybody wanted to go back to normal, desperately. We did, but we didn't have the luxury of just going for it because the consequences would be so severe. But it was kind of like a reminder. I think we became a bit of a reminder that actually, almost like the party poopers, was how it felt. So there's a lot bundled in there. But generally, I think people on the whole, are more empathetic than perhaps we give people credit for. Mm-hmm. They want to do the right thing. Mm-hmm. They don't always recognise the value of talking to people with lived experience or know how to access them. Mm-hmm. So, yeah, there's a lot in there. Sorry, that was a devil of a question you put there, John.
Sorry, I couldn't resist, and perhaps we can sort of end on that optimistic note that people are more empathetic than they might be presented to be. Just to respect people's time, I think we'll have to call it a day there. But Sally's put her email in the chat, and I'm sure Anna can either do the same, or you can search her King's College London profile and reach out if you have any other questions. But I'd just like to say, thanks everyone for coming along, and I hope you enjoyed it. There are more opportunities to keep up to date with what we're doing in the HESTIA network, including future webinars. So if you're not yet a member, please do consider joining. But thanks again, everyone, for coming, and have a lovely rest of the day.
Thank you so much.
Thank you. Thanks a lot. Good luck, everyone.